1.
Hi, everybody. I'm Tina Sanger, and I'm here with Jessica Friesen. We're doing assignment 3, structural family therapy. Okay. What is structural family therapy? A quote by Maya Angelou, "I sustain myself with the love of family." History, who, what, and where. A pediatrician, Salvador Minuchin, in 1960, noticed his young patients were not getting better with traditional individualized therapy. He wanted to treat his patients by examining the family structure to help them more. He was working in New York at the time with lower class single parent families. He believed the family's homeostasis was key in treating his patients rather than focusing on the individual being the issue. So structural family therapy was created. This therapy can be applied to single parent families, trauma recovering families, substance abuse, and families with children with special needs. Examining relationships and behavior is key in this type of therapy.
Assumptions of the family unit. Basic assumptions of the families are thought to be able to solve their own issues, but often they forget they can and they do not apply these methods. Issues can arise from rigid and weak boundaries that can affect the closeness of this family unit. Individual suffering in the family is the result of problems in the family system. All families aim for homeostasis. Families want to act in goodwill towards one another. In this therapy, families are examined through the life cycle model. Family dynamics are ever changing and restructuring is ongoing. Each member is developing and moving through these stages. It is important that these stages are recognized as normal growing pains and not pathological patterns. There are 4 stages of development. The first is the couple formation, where roles are established between the 2 members. Next, we see families with young children. This stage interrupts the previous stage, and there is a rearrangement of roles. There is also the arrangement of family relationship with birth order. Thirdly, there is families with school-age children or adolescents. This is where there's a recognition of outside systems being introduced that influence the inner system. Families with grown children is the last stage, where there again is a renegotiation of roles, and parents learn to couple again. These stages are important when we talk about how we interact with children. For example, you may use a certain correction technique with a 5-year-old, such as a timeout on the stairs. But this method would not be appropriate with a surly teenager who scratched the family vehicle. They would not take kindly to sitting on the stairs, or perhaps they would prefer this to a loss of driving privileges. But in any case, this punishment would be less effective, while loss of driving privileges would mean nothing to a 5-year-old for punishment.
Okay. Subsystems. Families may have subsystems running within the families. This can include the marital subsystem, a parent-child subsystem, and the sibling subsystem. These can be measured by active boundaries set between members. Hierarchy of subsystems. Families have subsystems which alter power levels by having a hierarchy in place. Most families have parents or caregivers at the top of this hierarchy, holding the authority of what is best for the family's children. Some families run opposite to this structure and are ruled under the children's authority. Other families have one parent holding the power over the family, including the other parent, where children may end up being afraid of the controlling parent. In any of the cases, if power is not consistent, confusion will be felt by the family members, particularly young members, who may defy their parents because they are unsure who and what rules to follow.
Our key terms are boundaries, enmeshment, triangulation, and parentified children. Boundaries. Dysfunction occurs when boundaries are too weak or too rigid, also called disengagement. Rarely do things stay the same in families, and families must remain open to adapting. Boundaries that are hard set, that have no flexibility to stressors. We need boundaries to be able to define the self and create a sense of separation from others, to feel important as we are. Boundaries protect our well-being by taking care of the self. A person who has weak boundaries will have a hard time prioritizing themselves. In a safe relationship, one would be able to take time to themselves and pursue who they are and their well-being with esteem to do so. People with boundaries can say no and not feel guilty when they do not do what others ask them to do. People with boundaries, with poor boundaries, have a difficult time with choices when faced with decisions. They often feel responsible for the other's feelings. People with poor boundaries are often people pleasers in that they give too much. When faced with disagreement, they often agree to just keep the peace. Physical signs of poor boundaries are feeling burned out after social interactions. Rigid boundaries, on the other hand, would not allow for any intimacy to occur. Structural therapy would work on people being confident that if it is not the right choice for them, it is okay to say no. Working on creating a sense of individuality and the self allows families to become closer rather than becoming one by setting up lines that cannot be crossed. Enmeshment. Weak boundaries lead to enmeshment, where it is unknown where one member ends and one begins. Members in this situation must conform to most of the members' beliefs and preferences. Groupthink is strong in enmeshed families, where members share each other's emotions and opinions. Not having friends outside the home, no outside interests, no privacy, and an over-involvement with each member of the family. There is an extreme loyalty where secrets are kept and outsiders kept at bay. Parents may be over-involved in making plans for older children, picking out their clothing and not allowing them to become an individual. Doors may be made to be kept open and not locked. No privacy to grow their own sense of responsibility, making members question their judgment and become paralyzed by decision. One may feel guilty or shameful when they need time alone or wanting to engage in activity without the family. This would look like family drama, having members pick sides against one another, and not being able to define boundaries. Structural family therapy would address this by recognizing these patterns and setting goals, such as forming boundaries and creating a sense of the individual self. Triangulation. Triangulation occurs from an enmeshment of subsystems and having these subsystems pitted against other family members. Alignments may form when there is a joining or opposing with one member or systems over other members or systems in the family unit, which is sometimes referred to as correlation. This may lead to other family members becoming jealous, anxious, depressed, or withdrawn. This can be seen when parents argue and bring children into the fight to take sides, or when children are fighting and the parent resolves the issue instead of letting them resolve it. This creates a sense of us against them and insisting on picking sides. The person on the outside will feel alone and rejected, while the person brought into the triangle may feel overtaxed, having the responsibility of staying on the side where they were brought into and being manipulated. Triangulation also clouds the important issues, making it more about who agrees with who. Structural therapy would work on showing how the triangulated person feels and create a sense of empowerment for the individual taking sides so that they can stand alone to convey their hurt, feelings, or needs, creating a sense of the self. It would also bring to light issues that need attention so they can be worked on. Parentified children. This results in the lack of boundaries between parent and child, where a parent confides in one child about marital problems or expects the child to work in the family business. A child who is a victim of parentification will often suffer from anxiety from the responsibility that has been forced on them. They may also be privy to information that they may not understand, such as grown-up issues, such as family's financial situation. As a result, the child may suffer stomach aches without a known cause. The behavior of the child may become more aggressive. They may have relational problems with peers or suffer academically. These children often take care of others rather than having had a chance to be a child themselves. Structural therapy would bring this to light and focus on broken down subsystems, such as the parent subsystem, that needs to be strengthened so the child can focus on being a child and the parents taking care of the issues to protect them.
Goals of structural family therapy. Structured family therapy attempts to set clear boundaries and hierarchical structure, as well as strengthen subsystems such as the parental subsystem. The therapist would learn about the family and their goals. A treatment plan would be created with goals and expectations of the family members. The therapist does not solve the family's problems, but rather aim to empower the family to fix their own functioning for lasting results. The therapist. The therapist would create the family by joining the family. The therapist would treat the family by joining the family and by building a therapeutic alliance and validating each member of the family. They would aim to become part of the system to heal the family from within, often even taking on mannerisms of the members. This begins with observation and analyzing their behavior and patterns and communication styles. Okay. Mapping. Mapping is when the therapist asks members to relay what they think the problem in their family is without interruption or judgment, to create a map of how the family relates to one another. This would enable not only the therapist to see the viewpoints of members, but also allow the members to hear what their family sees as the issues. This may bring to light emotions and circumstances others were not aware of. Once the therapist makes a map of the family, they attempt to join the family, keeping their role as therapist, but taking on mannerisms of the family to gain alliance. The therapist also makes accommodations, such as if members are wearing short sleeves, they will take off their jacket as well to fit in. Reframing. When the therapist offers another way of looking at the problem, this is called reframing. This allows members to see others' point of view in a more positive manner that they might not have thought of themselves by only seeing their own point of view. An example may be when a brother claims their smaller sibling is pestering them. The therapist may suggest that the smaller sibling may just look up to their older brother and want to learn from them. This technique aims to soften negative feelings to make members feel safer. Enactment. Kind of feel like
Oh, wait, sorry, there was just an additional example may be a nagging mother. The therapist may work on others viewing this nagging in a better light. Rather than nagging because she does not trust the other member, the mom may have a fear of failure. She may be attempting to shelter her children from making mistakes and having painful consequences. The therapist will also work with the mother and try to reframe her thinking that mistakes are the end of the world and get her to look at mistakes as a learning or teaching moment. Consequences set children up to assess their situation independently when parents are not around them. The goal of raising children is for them to become successful adults. If a child does not fall, he will not learn to stand on his own. Reframing this situation may make the mother rethink her nagging.
Thank you so much, Jessica. Enactment. Therapists may ask the family to act out an earlier conflict with the goal to make closer observations of patterns of how the members relate to one another in terms of boundaries. This gives the therapist a front row ticket to witness what is going on in the home. This could also be a good way for members of the family to witness what others took from the conflict and how they interpreted what the issue was. Restructuring. This is when the therapist aims to interpret the current homeostasis by setting boundaries, unbalancing the family by taking one member aside privately or heightening an emotion to show how severe the behavior may be. Most people run on patterns and get into ruts. This applies to families as well. It is easier to walk in a forest on a well-walked path rather than create your own. Change is hard and takes effort, but if the path does not serve all, then a new way forward allows the family to create the path together. Patterns make it hard for families to see how their behaviors affects others, because it is hard to look in and admit when you may have been hurting someone. Shaping competence. Praise is when the therapist notes out loud positive behaviors. This may be seen when the therapist sees the parent enforcing rules, setting a hierarchy of power and comments on this, such as an older child who is running around the room during the session, and the parent tells the child that they need to sit while the therapist is talking. Even if the child does not stop, the therapist would focus on the parent's attempt to set a rule and encourage the parent to continue to enforce this rule. This validates the parent's efforts for change. This is referred to as shaping competence. This reinforces changes and brings confidence to the family members to create these subsystems that allow a hierarchy to occur.
Another example of this is if the child learns emotional dysregulation techniques, such as taking deep breaths and taking a moment to think when they are getting upset. The therapist might comment on this or encourage the parent to positively reinforce the child's behavior. This would also establish the power hierarchy in the parental system. This reinforces these changes and brings confidence to the family member to create these substances to allow the hierarchy to occur. Limitations. One of the cons of structural family therapy is the use of role playing, which requires active participation. This could lead to a level of discomfort for the family. A negative aspect is also if each member is not willing to participate in the therapy. The duration of this treatment varies on the individual family situation and commitment. This approach is dependent on the cooperation of family members. The duration of the treatment varies on individual family situation, being weeks, and it could last several months. Without willing participation, this treatment will be less effective on the family structure. Another key limitation to this approach is the lack of the female perspective at its birth and beyond. Structural family therapy looks at the structure, but not at the gender power differences. Past and current social demands on women vary from that of men. The female is working out of the home more and more now. However, the tradition of the woman being the primary caregiver for the children and a homemaker remains in a lot of households, with the mental load taxing the female, plus having work demands on top of it. This may function well in some households, but not all. This therapy does not address these differences unless within sessions, but not specifically. Generational differences are also addressed with examining hierarchy in the subsystems and life cycle changes, but not the hierarchy roles within the couple, which is an important subsystem. Societal demanding effects of damaging effects of demands placed on females, such as the woman having an expressive role and the man having an executive role as a circulatory pattern, is not addressed. There's also the lack of cultural awareness. Structural family therapy was designed around American ideals. This could be problematic for those from cultures with less defined boundaries between generations, who may not be willing to change these aspects within the home. This approach does allow for multiple types of family, be it divorced family, single parent, nuclear, same-sex or non-binary families, but not much is addressed within cultural differences. Another limitation would be if there was a need to address individual issues. This would include a mental disorder diagnosis or learning disability. Structural family therapy would work within the system to address these issues as a whole and the effects on other members, but not allow for individualized treatment. This would need to be worked on more in a one-on-one setting, which may then be incorporated into the system.
Okay. Why did we choose structural family therapy?
Well, I, Jessica, came from a family that lacked boundaries. Because we lacked boundaries, we suffered enmeshment as well as triangulation. This happened with my sister, mom, and dad pitting me and me becoming the scapegoat of the family, which has caused me trauma over the years that I'm now working on. Structural family therapy may not have addressed individual mental disorders within my home, such as addiction and abuse, but it may have been a tool to lessen the trauma infected by the mental disorders going on unaddressed. By researching structural family therapy, it has been a teaching moment, allowing me to learn how to structure my own current family of 4 children and create a healthy family with flexible boundaries and recognize patterns of triangulation. I do not want to repeat patterns from my past. I want to fix them before they isolate other members of my household.
Okay. And I, Tina, was raised in a nuclear family with 11 siblings, 9 sisters, and 1 brother, with a passive alcoholic father and abused mother. I was the fighter in the family because I wanted to keep my mother safe from the physical and verbal abuse. My siblings and I have a very close bond. We are resilient and have worked through traumatic events from our childhood. Structural family therapy would notice our close sibling bond in spite of our trauma and will allow restructuring to occur. With my own children, I have made sure that there is no triangulation. My children are very close, my 3 sons, and they support each other in everything they do in life. And so Jessica and I feel that structural family therapy is the foundation of the therapeutic session addressing problems in functioning within the family. The function of the behavior is often caused by environmental stressors that the child cannot control. When they feel out of control, they may have a behavior burst, which indicates they have low distress tolerance for the demands you're placing on them. This very same outcome can happen to families that feel stretched. Jessica and I would like to thank you for your time in reviewing our presentation. Please feel free to take a look at a brochure that we have attached at the end of our presentation. Our contact information is closed. Should you have any questions, you can get in touch with us. And
We have additional resources if you want to learn more about this family therapy, so you can integrate it into your sessions and help with your client. A wonderful, straightforward video on this topic is Goals and Phases of Structural Family Therapy. You can find it in 2 different formats, Bing or YouTube. A next video goes about the techniques of this therapy, explains its history and more on Mnuchin and how he came up with this therapy. Lastly, we have included a family session using structural family therapy. This is the last video, and you can be free to watch an actual session in progress. We've also included a list of references, which we use to create this PowerPoint. There's also a video included in there as well. Thank you for coming today.
thank you so much. And we thought we would quickly show you, these are our families. I'm a single family household. Jessica is from a nuclear family, and this is Jessica's extended family. And these are our references. Thank you again for your time.